Welcome to this comprehensive lecture on echogenic microbubbles and their revolutionary applications in super-resolution ultrasound imaging, diagnostics, and therapy. Microbubbles are gas-filled microspheres that revolutionize medical imaging by enhancing ultrasound contrast and enabling unprecedented resolution. Let's begin by understanding the fundamental structure and properties of echogenic microbubbles. Microbubbles are tiny spherical structures with a gas core, typically containing perfluorocarbon or nitrogen, surrounded by a stabilizing shell. The shell is typically made of lipids, proteins, or polymers, with thickness ranging from 2 to 200 nanometers, while the entire microbubble diameter ranges from 1 to 10 micrometers. These dimensions are crucial because they're smaller than red blood cells, allowing microbubbles to flow freely through the microvasculature. The bubble diameter of 1 to 10 micrometers is slightly smaller than red blood cell diameter of approximately 7 to 8 micrometers. Common shell materials include phospholipids, albumin proteins, or biocompatible polymers that provide stability and biocompatibility. The gas core typically contains perfluorocarbon gases like sulfur hexafluoride or octafluoropropane, which are highly stable and echogenic. Now let's explore the physics behind how microbubbles interact with ultrasound waves. You might wonder, why do these tiny bubbles create such strong ultrasound signals? The answer lies in acoustic impedance mismatch. Acoustic impedance Z equals the product of density ρ and sound speed C in a medium. For soft tissue, acoustic impedance is approximately 1.6 million kilograms per square meter per second. For gas, acoustic impedance is only about 400 kilograms per square meter per second, creating a massive impedance difference. This diagram shows ultrasound waves encountering the tissue microbubble interface. The huge impedance difference causes strong reflection, making microbubbles appear bright on ultrasound images. We can quantify the strength of ultrasound reflection using the reflection coefficient. The reflection coefficient R equals the square of the impedance difference divided by the impedance sum. For the tissue-gas interface, nearly 100% of ultrasound energy is reflected, creating extremely bright echoes. Microbubbles don't just reflect ultrasound passively, they oscillate and resonate in fascinating ways. When ultrasound waves hit microbubbles, the pressure variations cause the bubbles to expand and contract rhythmically. This animation shows how microbubbles pulsate over time in response to ultrasound pressure waves, growing and shrinking rhythmically. The motion of these oscillating bubbles is described by the famous Rayleigh-Plesset equation. This nonlinear differential equation relates bubble radius r, its acceleration, velocity, internal gas pressure, ambient pressure, and driving ultrasound pressure. Every microbubble has a natural resonance frequency where it oscillates most strongly. The resonance frequency equals 1 over 2 pi r naught times the square root of 3 gamma p naught over rho. Let's work through a numerical example for a typical 3 micrometer diameter microbubble. The radius is 1.5 micrometers or 1.5 times 10 to the negative 6 meters. Using atmospheric pressure of 100 kilopascals, water density of 1,000 kilograms per cubic meter, and adiabatic index of 1.4, we calculate a resonance frequency of approximately 2.2 megahertz, which falls perfectly in the diagnostic ultrasound range. This is not a coincidence. Medical ultrasound frequencies from 2 to 10 megahertz are specifically chosen to match microbubble resonances. One of the most powerful features of microbubbles is their nonlinear response to ultrasound. When driven by sufficiently strong ultrasound, microbubbles exhibit highly nonlinear oscillations. Here's the input ultrasound wave at fundamental frequency f0, which is a simple sinusoidal wave. But the microbubble response contains not just a fundamental frequency, but also second, third, and higher harmonics, creating a distorted waveform. These harmonic frequencies at integer multiples of the fundamental are unique signatures of microbubbles. The echo pressure contains the fundamental at frequency f0, plus second harmonic at 2f0, third harmonic at 3f0, and so on. Here's why this matters. Normal tissue responds almost linearly, producing mainly fundamental frequency echoes. By using harmonic imaging that filters for these higher frequencies, we can isolate microbubble signals from tissue background. This technique provides contrast to tissue ratios exceeding 20 decibels, dramatically improving image quality. Now we reach the breakthrough technology, Superresolution Ultrasound imaging using microbubble localization. Classical ultrasound imaging faces a fundamental limit called the diffraction limit. Wavelength lambda equals sound speed c divided by frequency f. At 5 MHz in tissue, wavelength is approximately 300 micrometers. The diffraction-limited resolution is approximately half a wavelength, or 150 micrometers. This 150 micrometer limit prevents imaging of capillaries and microvessels smaller than 10 micrometers, which are crucial for disease diagnosis. Superresolution ultrasound localization microscopy breaks through this barrier by precisely tracking individual microbubbles. The key insight is to inject very dilute microbubble concentrations so individual bubbles are spatially separated in each ultrasound frame. Even though the diffraction-limited spot is large, we can determine the center position of each isolated bubble with nanometer precision. The localization precision sigma equals the point spread function width divided by square root of n, where n is the number of detected photons or echoes. Typical localization precision achieves 10 to 20 micrometers, which is 10 times better than diffraction-limited resolution. By accumulating localizations from thousands of video frames over several seconds, we build up a detailed map of the microvasculature. The final result is a super-resolution image revealing vessels and structures far below the diffraction limit. Super-resolution requires capturing thousands of frames quickly, which demands ultrafast ultrasound technology. Traditional ultrasound systems acquire images at 30 to 100 frames per second, which is too slow for optimal microbubble tracking. Ultrafast ultrasound systems achieve frame rates from 1,000 to 10,000 frames per second, capturing rapid microbubble motion. The theoretical frame rate equals sound speed divided by twice the imaging depth. For 5 cm depth, maximum frame rate is 400 frames per second. Ultrafast imaging uses plane wave transmission instead of focused beams. A plane wave insonifies the entire field of view simultaneously, eliminating the need for time-consuming scanning. The trade-off is lower signal-to-noise ratio per frame, but the dramatic speed increase enables techniques impossible with conventional imaging. Image quality is recovered by coherent compounding of multiple plane waves transmitted at different angles. Ultrafast imaging, combined with microbubble tracking, enables precise measurement of blood flow velocity. By tracking each microbubble's position across consecutive ultrafast frames, we calculate its velocity vector. Velocity vector equals displacement vector divided by time interval. The velocity magnitude equals the square root of x displacement squared plus y displacement squared divided by time interval. Let's calculate velocity for a typical scenario. A microbubble moves 100 micrometers in 1 millisecond. This gives velocity of 0.1 meters per second, or 10 centimeters per second, typical for capillary flow. By mapping velocity vectors across the entire field, we create detailed, hemodynamic maps revealing flow patterns and perfusion. These velocity maps reveal perfusion defects, vessel stenosis, turbulent flow, and other hemodynamic abnormalities crucial for diagnosis. Let's explore the transformative diagnostic applications of microbubble-enhanced ultrasound. In cardiology, microbubbles enable assessment of myocardial perfusion to detect ischemia and infarction. In oncology, super-resolution imaging characterizes tumor angiogenesis, revealing chaotic microvascular networks that indicate malignancy. Compare the chaotic, tortuous microvessels in tumors on the left versus the organized, parallel vessels in normal tissue on the right. In neurology, microbubbles assess blood-brain barrier integrity, crucial for stroke, Alzheimer's disease, and brain tumor diagnosis. You might ask, why not just use MRI for all these applications? Great question. The answer involves multiple factors. Ultrasound is far cheaper, faster, portable for bedside imaging, and provides superior temporal resolution for dynamic studies. MRI costs $1,000 to $3,000 per scan and takes 30 to 90 minutes. Contrast-enhanced ultrasound costs only $100 to $300 per scan and takes 10 to 30 minutes. Additionally, ultrasound provides real-time imaging at millisecond resolution, capturing rapid vascular dynamics impossible with MRI. Beyond diagnosis, microbubbles enable revolutionary therapeutic applications through acoustic manipulation. High-intensity focused ultrasound can manipulate microbubbles to deliver drugs, open biological barriers, and ablate tissue. First, microbubbles can be loaded with therapeutic drugs or genes and targeted to specific tissues. Drug-loaded microbubbles carry therapeutic payloads through the bloodstream to target sites. When ultrasound bursts are applied at the target site, microbubbles oscillate violently and eventually rupture. The pressure threshold for microbubble destruction ranges from 0.5 to 2 megapascals. Bubble destruction releases the drug payload locally and creates temporary pores in cell membranes, enhancing drug uptake. Second, focused ultrasound with microbubbles can temporarily open the blood-brain barrier for drug delivery. Blood-brain barrier opening requires careful parameter control. Pressure of 0.4 to 0.6 megapascals at frequencies 0.5 to 1.5 megahertz. Microbubble oscillations generate mechanical forces that create transient, reversible disruption of tight junctions between endothelial cells. This diagram shows microbubbles near the blood-brain barrier, creating temporary openings that allow therapeutic drugs to enter the brain. This technique opens revolutionary possibilities for treating brain tumors, Alzheimer's disease, and Parkinson's disease with drugs that normally cannot cross the barrier. With such powerful capabilities comes important safety considerations governed by the mechanical index. The mechanical index quantifies the potential for mechanical bioeffects from ultrasound exposure. Mechanical index equals peak rarefactional pressure in megapascals divided by square root of frequency in megahertz. The FDA limit for diagnostic imaging is mechanical index less than 1.9. When using microbubble contrast agents, much lower mechanical indices are employed to prevent premature bubble destruction. Contrast imaging typically uses mechanical index of 0.1 to 0.4 to preserve microbubbles for sustained imaging. Therapeutic applications intentionally use higher mechanical indices to achieve bubble destruction and tissue effects. Therapeutic ultrasound uses mechanical indices from 1.0 to 1.9 for controlled bubble destruction and drug delivery. An important question: are microbubbles safe for patients? The answer is yes. Decades of clinical use with millions of patients demonstrate excellent safety profiles. Microbubbles are rapidly eliminated from circulation via exhalation through the lungs within 2 to 10 minutes. The circulatory half-life is approximately 2 to 6 minutes, minimizing exposure duration. Let's explore advanced imaging modes that leverage microbubble properties. Pulse inversion imaging is a clever technique that exploits microbubble nonlinearity. First, transmit a positive ultrasound pulse. Then transmit an inverted negative pulse with opposite phase. Linear scatterers like tissue produce echoes that cancel when we sum the responses to both pulses. But nonlinear microbubbles produce asymmetric responses that don't cancel, remaining visible after summation. For linear tissue, echo 1 plus echo 2 equals 0, complete cancellation. For nonlinear microbubbles, echo 1 plus echo 2 does not equal 0, leaving strong signal. Amplitude modulation is another technique, using multiple pulses at different amplitudes. Transmit 2 pulses with amplitude ratio of 1 to 2. Subtract the appropriately scaled responses to cancel linear tissue echoes while preserving nonlinear microbubble signals. The process signal equals echo 2 minus 2 times echo 1, isolating nonlinear components. Superresolution ultrasound enables quantitative measurement of tissue perfusion parameters. By analyzing how contrast intensity changes over time, we extract quantitative perfusion parameters. This time intensity curve shows rapid wash-in as microbubbles enter tissue, reaching a plateau representing steady-state perfusion. We can extract several key hemodynamic parameters from time intensity curve analysis. Peak enhancement equals peak intensity minus baseline intensity, reflecting blood volume. Time to peak indicates how quickly blood reaches the tissue. Wash-in rate equals peak enhancement divided by time to peak, representing tissue perfusion rate. Area under the curve integrates intensity over time, providing overall perfusion index. By comparing these parameters between normal and diseased tissue regions, we detect perfusion abnormalities, For example, ischemic tissue shows decreased peak enhancement, increased time to peak, and decreased wash-in rate. Superresolution imaging provides quantitative metrics of vascular density and tortuosity. Vascular density is the number of vessels per unit area, reflecting angiogenic activity. Vascular density equals the number of vessels divided by the region area. Tortuosity is a measure of vessel bending and curvature associated with disease progression. Tortuosity equals vessel length divided by straight line distance. This image shows tortuous vessels in diseased tissue versus normal vessels in healthy tissue, highlighting the diagnostic value of vascular tortuosity. In conclusion, echogenic microbubbles have revolutionized ultrasound imaging and therapy. Let's summarize the key points from this comprehensive lecture. Microbubbles exhibit nonlinear oscillations, generating harmonic frequencies that enhance ultrasound imaging. Superresolution ultrasound achieves subwavelength resolution, enabling detailed maps of microvasculature. Quantitative analysis of perfusion and vascular metrics offers valuable diagnostic information for various diseases. Microbubbles can be used for targeted drug delivery and temporary opening of the blood-brain barrier for therapeutic purposes. Safety considerations, including mechanical index regulations, are crucial for ensuring patient safety during microbubble-enhanced ultrasound procedures. The field of microbubble-enhanced ultrasound is rapidly evolving, with emerging applications in areas like cancer therapy and neurodegenerative disease treatment.